Hello, everybody. Hello. Those of you who are on Instagram this morning, hello. What about today? We got a great topic for today. Hold on just a minute. Let me make sure you guys can see and hear me okay. I'm getting a little bit of an echo. Let's see. Maybe I'll do okay. I think I fixed the echo. We're good now. Um, hey Sammy, yes, we are on. We are on. We're just going through a few tech glitches today. So we're going to talk today about what about your patients when they're not making progress, or even what about when your family member is not making progress? What are we going to do? We've tried everything in your bag of tricks and nothing has given you the results that you expected. And now what? So we're going to talk about those things. Did you know that sleep apnea, teeth grinding, thumb sucking, ADD, ADHD, mouth breathing, and even snoring can all be from the same root issue? I did not. And as a speech language pathologist who treated patients with some of these issues for many years, I have been shocked at what I've learned this past year. And addressing the root cause with myofunctional therapy could be just the strategy you need to help your patients resolve the root issues and meet their goals more quickly. So, did you know that there's simple strategies right under your nose, literally, that you could begin implementing tomorrow, which could change the course of your progress, increase your patient success? Yes, these are tools that many therapists are not aware of. So I'm bringing on an expert today that's going to help shed some light on this topic so that you can do a better job of serving your clients. And if you are a parent on today or a spouse of someone with dealing with some of these issues, you will have better information to take to your therapist or to move forward. So if you're watching on the replay, thanks for watching. Those of you who are joining us on Instagram today, you are in the cheap seats. So come join us over on Facebook at 3 Life Essentials so you can see and get all the information from Andrea Butler today. Thank you guys for watching. Be sure to leave your questions, your comments, and give me some hearts and likes. It'll help us to kind of engage here as a community. And I'm curious, how many of you therapists or families receiving therapy or maybe if you're wondering you need to be, how many of you are dealing with one of the challenges that I just named? Just type in the comments, that's me. So that way I know who I'm talking to today. And you're in for a treat because speech language pathologist and oromyofunctional therapist and co-owner of Oral Facial Treatment, Oral Facial Texas, Andrea Butler, is going to be here. I'm going to bring her on. She's going to be showing us not only how to connect the dots here for us, but also to give us a game plan for real progress and change. And as an SLP myself, I've been blown away by what I've learned over the past year and the progress I've seen in my own kids and my husband. So, yes, so today we're going to be as we're celebrating, this is actually Dental Health Month. Did you guys know that? Actually, let me see. I'm going to bring Andrea on here with me. And let's see. Let me make sure I'm off of solo here. Actually, oops, let's see. Let me see if I can have both of us on here at the same time. Oh, here we go. There we go. And let me hide this down here. There we go. Now we're both on. Yeah, today we're going to be free from frustration and free from the unknown, free from snoring, free to see some progress, free to address the root issue, free to learn something new. And I have a gift for those of you who are tuning in. If you would like access to Andrea Butler's free screening tool and a full written guide to today's Free Friday, you can just type in the comments progress, and I'll make sure that you get those throughout the live today, even if you are watching on the replay. Anytime you hear something that is awesome or it's a new idea or a nugget that you want to hold on to, I want you to type in the comments "Free Friday" because I love giving away. I love giving away our little squeeze tools. These little squeeze tools we have right here to let you get all the last bit of goodness out of your toothpaste or your mud mask, and they remind you to oil up. So I love those tools and I love learning. So I love to reward those who love learning from other people too. So let me turn on this little tool here before I forget. And let's get started. So I want to introduce Andrea to you, but before I do that, if you are new with us, my name is Amy Miller, and I help fellow speech language pathologists set their practice apart by providing natural and effective solutions and tools that enhance the impact that they're already making in their patients' lives so that they can begin to see satisfied patients meeting goals more quickly. And my husband, Jim, and I are passionate about helping others feel better naturally. In fact, we're not just wellness advocates, we're advocates for change. And this is Free Friday. This is our weekly series on Fridays to help experience life more fully, more abundantly, and bonus if we can do this naturally, right? So let's face it, Andrea, many of us, especially as therapists, we've spent countless hours in school and continuing education. And I know that at some point when I was practicing, sometimes I had patients that were thumb sucking or unresolved articulation and fluency issues, or maybe I was dealing with ADHD and they weren't resolving the way I thought they should. And I knew there was more I could do, but I didn't know where to go. And I thought they were just going to be stuck. And the answers are out there, but I just didn't know where to look. So I know there's other therapists out there and even families who are feeling like that. So Andrea, we're so glad you're joining us today. So why don't you help us get started by even telling us, like, what is oral myofunctional disorder? What is all of that? That's like a mouth. I always thought speech language pathology was a mouthful. That's even more of a mouthful. I don't even know. Right? Okay. Oh, hold on just a second. You're muted. Let me unmute you. Okay, there we go.
Okay. Yes. And then you add orofacial myofunctional therapy to the mix and it becomes a whole jumbled mouthful. But in short, an orofacial myofunctional disorder, otherwise known as an OMD, is just an abnormal lip resting posture, tongue resting placement, muscle use of any of the muscles of the face, the tongue, the jaw, or noxious oral habits. That's kind of in a nutshell. On ASHA, they have a longer, more beautifully written definition. But in a nutshell, that's what it is.
Wow. Okay. So, and I know we didn't talk a whole lot about this, but what is the hold on, I don't know why we're getting an echo. I'll mute you for just a minute while I'm asking you a question. What is the tie-in then? What would that be, the tie-in, or maybe you're going to get to that, with snoring and sleep apnea, and how would that impact ADHD and mouth breathing and all that?
Yes. I'm going to flip the camera around onto a little PowerPoint quick with some visuals. Sorry, I was going to pull up on my computer, but it didn't want to cooperate today. So
It's
just some
good.
general signs and symptoms. Not every person presents with the same, but some things you might notice would be open mouth resting posture, structural abnormalities like a restricted lingual or labial frenulum, that's a tongue or lip tie, dental abnormalities, overjet, open bite, cross bite, any of those kind of things, abnormal tongue resting posture, articulation errors, especially for sounds like S, Z, SH, CH, J, J. You might also see more of a dorsum production with a T, D, L, or N, which should be lingual tip production. And then sometimes R phoneme would be an error. Drooling past the age of 2, the non-nutritive sucking, we talked about finger sucking, thumb sucking, nail biting, cheek biting, all of those kind of things. Lack of consistent lingual palatal seal. during liquid, solid, and saliva swallows. Then we get into the airway things that seem so obscure, but really they turns out that they're all related. The obstructive sleep apnea, disrupted sleep patterns with snoring, grinding, bedwetting, ADHD, behavioral concerns. Um, Also, kind of spills over into feeding disorders and ability to manage food, and then TMJ dysfunction or TMD and facial pain. Um, so, some things that you can look for easily in patients, and this would be a great indicator just right off the bat if you look in your patient's mouth or if you're a parent in your child's mouth, um, and you see uh, an open bite where there's space there where the teeth should be together, that we can all assume is, and probably all know or familiar with that to some degree, that the tongue is causing some issue there, the pressures of the tongue or the resting posture of the tongue. The overjet and overbite, things like that, those kind of things are also an indicator of oral dysfunction. And then also the crossbite is an indicator of airway dysfunction and something that's going on with oral function. So here, this is where we kind of get into how it's all related. Really, what the way that we're looking at things, I did not create this visual, but I love it. It was from Leisha Pasquet and was then modified by Nicole Archambault Benson, who's a speech pathologist and is very active in the myofunctional realm. That really, we're looking at patients who come to us with speech issues or possibly chewing or swallowing kind of symptoms. But the real base of all of it is breathing. That can be breathing during sleep or breathing in general. If airway is affected, all of the other things are going to be affected. So this is where you have to start in remediation. Posture is next. If things aren't in line, they don't function well. Then sucking, swallowing, chewing, and then speech would be the very tip of the iceberg. So just adopting this framework for thinking about the way you treat patients who come to you is huge, and explaining that to patients is huge. Okay, so the screening tool, let me pull that up real quick. I'm gonna flip the camera. Okay, the screening tool, like Amy said.
I just interrupt you for just a second there, Andrea. So, wow, that's really huge. Now, if you're joining us on Instagram, you're in the cheap seat. So come join us over on Facebook at Life Essentials so you can get all this juicy stuff. But that iceberg effect, so there's a whole lot going on beneath the surface that we're not even looking at,
Right.
As therapists, or even sometimes even knowing to look at. I mean, we've been trained to do oral mechanism exams and things, but there's so much more going on. And so I know as a therapist, if I didn't know about that, and I know I haven't been practicing, but you know, I've talked with current practicing therapists, and they're not aware of these issues either. Mm-hmm. So this is something that is enlightening to, even if your therapist doesn't know and you're a family member, then this is something you want to bring to the attention of your therapist for sure. Wow.
Just getting to those underlying effects is huge.
Yes.
Or underlying issues to be able to really address. And a lot of times when you address the underlying issues, the top of the iceberg things melt away. I've seen it happen with just changing tongue resting posture for a patient that they then began to correctly, with very little articulation intervention, correctly produce the S and Z.
Okay, so I want to just interrupt you really quickly again here. I'm going to mute you again because for some reason, I'm getting feedback when I talk for just a minute. But I just want to interrupt you because this impacts 4 of the 5 in my family, 4 of 5 family members. And I know that I'm not the only one dealing with these kinds of things. And so it can impact kids as well as adults. And this is something that if you're blown away by some of this information, what you're discovering here, just type in the comments free Friday, because this is a lot to absorb. And so this is really helpful, because I know that even just as we just started with Andrea over this past year, I have seen fluency issues resolve with both of our twins, and I've seen thumb sucking resolve very quickly after starting the therapy. And so I agree. I'm saying firsthand too that I'm seeing the same thing. So so how can we know if we need to look into this type of therapy?
So I pulled up the screening tool. I'll flip it back around, but you guys have access to it on a PDF.
Okay.
And you can quickly incorporate this little screener into a therapy session or as part of an evaluation with an oral mech. So let me flip around and I'll just kind of give you a quick view of that. So this, I did not create this. It was a free tool given to us, and we have used it with many practitioners, offices, and other therapists that we work with. Um, First, you would just assess looking at breathing. Are the lips open? Are the lips closed? Are they breathing through their nose or their mouth? Are they able to breathe through their nose? So you want to see, is it a habitual issue or is it a medical issue? Um, if they're actually, before they get 20 breaths through the nose, if they're having panic or feeling like they're really needing to open their mouth to breathe, there may be some obstruction that needs to be addressed by an ENT. So that gives you a good place to go there to take care of that before you start doing any myofunctional therapy to change the behaviors or the positioning of the lips. Um, then looking at lips, are they chapped or bleeding? Look at the tongue. Where does it rest? If it's visible at rest, hanging out of the mouth or between the teeth, that's an issue. Our tongue should be resting in the roof of our mouth, completely lying flat in the palate. Look at that occlusion that I showed the pictures of, open bite, open jet. If you see those are huge indicators there's something going on, something is dysfunctional. Frenulum, look at this, should say, one of these should say labial and one of these should say lingual, I believe. So you want to look at the lip tie, the upper lip. Is it tied or does it have adequate mobility? And you want to look under the tongue. This is a whole little rabbit hole. I'm not going to go far into the tongue tie today, but that is a very significant aspect of orofacial myofunctional disorders. Then swallowing, we look at what's happening when they swallow. You ask a patient to smile while they swallow some saliva and hold those lips back. Can they do it? Do you see that tongue fly out? Do you see strain on their neck? Those are all indicators. Looking at the jaw, when you have them just move their tongue side to side, let me flip back around. If you have them just move their tongue side to side, do you see just the tongue move? Or do you see that is some dysfunction if the whole jaw has to follow the tongue? Um, Bracing, do you see patients bite, like it looks like they're biting their tongue, or we think, oh, concentrating. It used to be what I thought, oh, they're really concentrating. They're bracing on with their tongue on their jaw. They're looking for stability. Maybe there's a breathing issue. Maybe there's a postural issue. Things that you need to address under that tip of the iceberg. Then again, thumb sucking, tongue sucking, clenching on down, and then some speech samples. So that is just a simple little screener you can incorporate into therapy or an evaluation.
Yeah, I love that. Thank you so much for giving some clarification about that. And even you may have even wondered, if you want to connect even more dots, you can see some previous interviews that I did with Dr. Teresa Scott and Dr. Felix Liao that will connect even more dots for you about epigenetics and the structures and the dental side of all of this that will blow your mind even more. And so if you want to see those, you can get those when I share our written guide. I'll share the links to those interviews as well. Or you can just go straight to our website at 3lifeessentials.com and go to the blog there, and you can see those interviews. So Andrea, before we close out, what is there anything else that therapists or and parents, maybe if there's a parent watching, or maybe a spouse of someone maybe who's snoring like mine, what else do they need to know?
Well, first, have an assessment to find out what's really going on. What is the root cause? Is the airway functioning well? Are there postural issues? So, looking at all the parts of it with a good differential diagnosis to be able to move forward in therapy. Um, and then, some simple things you can do at home, starting with posture and breathing. Work on that diaphragmatic breathing. Start in a lying down position. Learn how to activate the diaphragm.
Everybody's breathing now.
And then do it in an upright position against a wall with your head back. Our ears should be over our shoulders. So many of us have a forward head carriage posture because of technology and lifestyle habits. And sometimes there are other implications with tongue tie and things like that that are causing some postural issues in that way. But that's a simple one to start with posture and breathing. Lip closure. For an adult or for a child, you might use like a, as long as the patency of the airway has been established, there's no obstruction happening, you can use a little sticker on your lips just to remind you to keep your lips closed while you're not talking or eating. Our lips should be together unless we're smiling, talking or eating. Um, Moving the tongue, working the tongue, because so many of us, myself included, before I started this and learned more about it, our tongues are weak, our jaws are weak. So building strength and stability for those through natural chewing exercises with like food, chewy foods, beef jerky, crunchy vegetables, um, tongue. We do some tongue resistance. The Mayo Munchie. I didn't bring any in here, but yes, the Mayo Munchie is a great option for building some
My
strength.
son is doing great with it, by the way.
I'm
Great.
so glad, so
Yes.
glad. So those are just some simple things. There's for lingual resting posture, we might hold a tangible of some kind, maybe a little sunflower seed or a little orthodontic band up to the incisive papilla there behind your teeth, and then learn how to elevate the rest of the tongue to teach and train those muscles, repattern those muscles to establish the correct positioning. Some of those things can't be addressed if there is a tongue tie or a lip tie. Those need to be addressed before you can make adequate progress. But sometimes functionally you can just work on it and it makes a huge impact.
Wow. So much goodness that you've been sharing with us today, Andrea. I'm so excited. I invite you to take in the information that Andrea has shared and make a step forward. That the next step that you need to make for your patients, for the clients that you're serving. If you are a parent or a spouse that's watching, look for some of these things. See if you need to take the next step in seeking a therapist. Is there a website to go to, Andrea? How can they connect with you or maybe find a myofunctional therapist in their area? What
Yes,
can they do?
there are a couple of PDFs with some resources for professionals and one with resources for parents that they can have access to. Um, www.orofacialtx.com is how you get in touch with us. OROFACIALTX.com. If you want to just reach out with questions or more information, we're happy to help with that. IAOM.com is the International Association of Orofacial Myology. And there are professional resources there. You can locate providers. Now, I will say not all providers who have been trained in orofacial myology are listed there. They're only providers that have been trained by that organization. Um, ASHA actually has a where you can search for practices on there as well. So those are some places to start, and you can ask good questions. I think I put that on the resource papers. Just you can call a speech pathologist if you're a parent looking for service and ask if they've had training, if they know about this.
Yeah. Do you get referrals from other speech language pathologists?
Yeah, from some that are in the schools, I think generally there aren't that many that are really aware of it. So just spreading awareness at this point, I feel like people are going to start becoming aware and learning more about it. But right now, it's that's a little bit of a challenge.
Yeah, yeah. Well, thank you so much, Andrea. Let's do just kind of a speedy recap right here that before we go. Um, believe it or not, snoring, sleep apnea, mouth breathing, ADHD, all of these can be have a root cause, could have a same root cause, and it could be answers could be found in oral facial myofunctional therapy, and so we want you to look for those signs. Use the screening tools that Andrea is giving us so generously. And I thank you so much for giving of your time today, Andrea. I'm about to sign off. I thank you guys for so much for joining us. Our next live wellness masterclass will be Friday, March 6th. It'll be a complimentary masterclass on your toxic thoughts are killing you. Literally. Sometimes if you feel like that negative tape is running in your head that never ends, I don't know if you ever feel that way, Andrea, but it doesn't have to be that way. There's actually ways that you can detox your brain and find a way to build belief in the positive again. We're going to be talking about a 21-day plan to do that. I know as a mom, many of you worry about passing along negative thinking to your kids. As a business owner like you in the health space, Andrea, you can't allow yourself time to get in that negative space or around negative people, right? Because you want to achieve the goals that you're setting for yourself in 2020. So if you're ready to switch on your brain by getting your mind under control, let me know below with the word masterclass, and I will send you the link to register for it. I love being here with you guys today. If you are so thankful for Andrea joining us, let her know below. Thank you guys so much. My name is Amy Miller, and I help fellow speech pathologists set their practice apart by providing some natural and effective solutions and tools to enhance the impact that they're already making in their patients' lives so that they can start to see patients getting faster results and not have so much frustration. So thank you so much, Andrea, for joining us. And thank you for your time. And we'll see you guys back for next week. Thank you, Andrea.
It was a pleasure.
Bye-bye.